Hello, everyone. Welcome to our Facebook Live program. Today's one of our Growing Healthier programs where we bring you speakers on important health topics. April is Autism Awareness Month, and we have two speakers today who work with children who may have autism, and they'll be talking about characteristics of autism in early childhood and types of therapies that we offer in CGH Pediatric Rehab. Our Growing Healthier programs are sponsored by the CGH Health Foundation, and we invite you to visit the Health Foundation page on the CGH website or to visit the Health Foundation page on Facebook to learn more about the work we do to help our people in our communities lead healthier lives. This year, the Health Foundation is focusing attention on dementia and Alzheimer's, and we'll be doing many things to educate and support families who have a loved one who might be suffering. The proceeds from our upcoming silent auction will be devoted to that cause. The auction's a virtual event. Bidding opens on April 29th, and you can find out more information on the CGH website or the Health Foundation's Facebook page. And before I turn it over to Dr. Bird, let me give you a preview of what next month's Growing Healthier program will be. On Thursday, May 12th at noon here on Facebook, Dr. Preeti Joseph from CGH Neurology will discuss the signs, symptoms, and treatment of stroke. She's a great speaker, so make sure you put that on your calendar. And if you ever miss any of our live programs, remember that we have them recorded and they're available for viewing on the CGH YouTube channel. So you just go to the CGH website, that's www.cghmc.com, and click on menu and find the link for radio and YouTube interviews under Health Resources. And I will turn it over to Dr. Bird.
Thank you, Sherry. Appreciate it. Good afternoon, everyone. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center. This is our April 21st, 2022 edition of Facebook Live, which, by the way, our marketing department tells me we've done over 100 of these since the start of the pandemic. So, hey, this isn't our first rodeo. Today, here's the roadmap for, 103, there we go. Here's our roadmap for today. So we're going to talk about autism first. And then when we get done with that, we're going to do a brief update on COVID. That's the plan. So without further ado, I'm going to bring in Laura Melville and Erika Smith. Hi, Laura. Hi, Erika.
Hello.
So Laura is an occupational therapist and works out of our pediatric rehab department. And Erika is a speech therapist and works out of our pediatric rehab department. So we thought that they would be the perfect people to have on to talk about autism, because I know that they work with kiddos that have that quite a bit. Welcome, ladies.
Thank you.
Yeah. So I'm going to start with just a pretty basic question, which is, would one of the two of you want to take a shot at how would you define autism?
Definitely. So in a very concise nutshell, autism at its core is a neurodevelopmental disorder. It is characterized by communication deficits that can include nonverbal communication, verbal communication, social communication, and it can also include restrictive or repetitive interests, activities, or behaviors. And typically these symptoms do develop within the first 3 years of life.
Okay. All right. That's pretty concise. Thank you, Erika. So the next question that at least comes to my mind as I was thinking this through is, it's not uncommon nowadays to hear that someone is on the spectrum. So I guess the next question I would throw out, are autism and being on the spectrum one and the same thing?
Yep, so that is the same thing, autism spectrum disorder. And that just basically means that all of the individuals just present with a wide variety of deficits and different abilities. So not every child that's been diagnosed with autism is going to present the same way. So that's why it's a spectrum, and we see a wide variety of different abilities and different things that we work with.
That makes sense. So Laura and Erika, I'm a little older than you. And when I was in even medical school, but for sure when I was growing up, autism was not something you heard a whole lot in terms of a diagnosis or a problem. So any thoughts on autism and the spectrum, if you will? Are we seeing an increased incidence in autism recently, or are we getting better at detection? What would the two of you say about that?
Yeah, well, and with autism, things are changing very rapidly. Even since I graduated from school 8 years ago, there has been a lot of changes in those just short years. So it is something that is changing very fast, and something that I know everyone in our clinic really has to work hard to make sure we're staying on top of, to make sure that we're providing the most up-to-date education to our families and, treating our patients. But in terms of your question, there has been research done on this. And basically what the research is saying, it is actually an increase in diagnosis. So there's a lot more awareness too nowadays.
Mm-hmm.
So the term autism has been around for a long time, about a century. But it didn't take on the current definition until about 20 to 30 years ago. And even in that time, in the last 10 years, it's, the definition has been changing pretty frequently. And way back when, I would say 40, 60, 80 years ago, there was really associated with mental illness, and just not anything like the current definition that we know now. So there's been a lot of positive changes in the stigma that surrounds it.
Okay. And just to be clear, when I say I go way back, it's not 60 or 80 years.
Oh, no.
Not just kidding. So I'm hearing that the research would say that actually there is an increased incidence of autism, even though there also is, along with that, an increased awareness.
Yes, but most of it is related just to better diagnostics.
Oh, okay. So it is doing a better job of identifying.
Yes, doing a better job of detection. Yes.
Okay.
Yeah.
Okay. So it's almost like it's been there, but it hasn't been identified as such.
Exactly.
Got it.
Yep.
Okay.
That's perfect.
All right. While I have you here and while we're doing this, the goal of this is to educate and inform the community. And I've got to ask this question because it has to come up with you all the time, or at least in the past. Do vaccines cause autism?
So for this question, it's obviously a controversial subject, but the researcher who actually published that article stating that there was a link between autism and vaccines, he lost his license, and then that article is just no longer, it's been discredited. So typically, there can sometimes be some regression in skills at that 18-month of age for our kiddos, and that kind of directly correlates to those vaccines at that time. However, the correlation is irrelevant. And there's a lot of research that has proven that there's no link between the two. But we always just say, ask your primary care doctors for any other questions, because that's more of like the medical side of things versus the therapy side of things.
Yeah. Couldn't agree with you more. Thank you. I had to ask the question.
I will say, I feel like I get that question a lot less than I have, 5 years ago. So
I haven't gotten
that. The message is getting out.
Okay.
I've only been practicing a year and I haven't gotten it. So
yeah, it's interesting because I started practicing. I started practicing in 1997, and I think that article came out in about 2000.
Mm-hmm.
Okay. Yeah.
And it was hot and heavy there for quite a while. So I'm glad that is simmering down some.
Yes.
Also in the bucket of gotta ask, since we're having this conversation, what would you ladies say about any recent evidence of a genetic or environmental source that increases the likelihood of a child having autism?
Yeah, so there is research has shown that there is most likely a genetic component. And in terms of more environmental types of things, the risk of having a child with autism does increase as parental age increases. So after the age of 35, we do see a little bit of an increased risk there. Problems during birth or pregnancy, such as prematurity or birth trauma, there is a little higher incidence in those populations.
Okay.
as well as other health issues like Fragile X syndrome or Down syndrome. Sometimes we do see a comorbid diagnosis there. There is also a higher incidence in males, but also with going back to genetics, a family history. So if you have a parent or a sibling that has been diagnosed with autism, there is a higher risk that another child might have autism within that family. But it should be stressed that just because your child is born premature or has a sibling with autism, that absolutely does not mean that another child will. This is just, we've seen a little bit of higher incidence with that. So we can be aware of that and make the appropriate referral if necessary. Yeah,
that's fair. That makes sense. So, if someone who's watching this, one of the things, if you're a parent, grandparent, someone that's involved with a little one, what are you looking for? What kind of symptoms would you see in a child who potentially is on the spectrum? And, what would that look like? And I'll bundle it in with another question is, and what age would you start to see that, Erika or Laura, whoever wants to take that question on?
Excuse me. So some of the symptoms and characteristics that we're kind of looking for may include that reduced eye contact, a lack of imaginative play, or just not being able to play in an appropriate manner for their age, any restricted interest. So if they really, really like one thing or just restricted to just very minimal things, not responding to their name, delay in speech or echolalic speech.
What does that mean? What does echolalic speach mean, Laura?
I'll let Erika.
Yeah, I'll take that. So echolalic speech is really scripting. So you might think of like a child that can, recite a line from Toy Story, but maybe they can't ask for, help washing their hands. So lots of times what we see is they'll use that script in lots of different situations, but lots of times they're using it in a meaningful way. We just kind of have to dig a little further to see what they're truly asking for.
Okay.
Or they might just hear a phrase that mom and dad use a lot, and so they're using that phrase a lot across a variety.
Layman's term, like parroting, is that what they're
exactly?
Okay.
Yep.
All right.
Yeah.
Got it.
And
I'm sorry, I interrupted you, Laura. Go ahead.
No, that's okay. And then just another few, any hand flapping, rocking, spinning, just kind of those repetitive behaviors, and then demonstrating little or no awareness to safety or danger. So, even if it's just crossing the street, not looking, not having not searching for that adult to help cross the street, just simple things like that.
Okay.
And then the American Academy of Pediatrics and the CDC also recommend that screening begins at about 18 months of age. So typically, those pediatric doctors are asking the same questions over and over and seeing if there's progress made or if they're kind of still answering those different questions the same way. And then just going from there at that 18-month to 24-month range of age and just determining at that time frame.
So it's like 18 to 24 months, kind of the window of when you would make the earliest diagnosis of autism?
It would be it can be made, but I would say in our experience, we don't see it diagnosed that early.
Okay.
Lots of times we want to get therapy started. We want to see if any progress can be made in therapy.
Yeah.
And lots of times families aren't ready at that point to take that next step. So, they want to try the therapy route. They want to see what happens in the next 6 months to a year. Another factor that plays into that is the wait list for developmental centers that formally diagnose autism are pretty lengthy. We're talking 6 months to 18 months.
Okay.
At the more popular centers. So,
okay.
Yeah. So that can delay diagnosis as well.
Yeah. Almost sounds like the diagnosis is a bit of a spectrum or a process, if you will, that you start to see things. It could be okay, but it may not be. And then over the course of a number of months, it becomes more clear.
Yes. And lots of times, I tell families, why don't we go ahead, get the referral started and if they make progress, in the next 6 months before their appointment, we can easily cancel that. But, at least we have the process started, so by the time they're 3 and they're ready to enter school, if we have that diagnosis in place, we can get a lot better supports in place for the family and the child. So.
That's a good segue, Erika, because I was going to ask both of you, what's the advantage of making an early diagnosis? What does that mean for a child and everything to make as early as possible a diagnosis of autism?
Yes, and I think a lot of the times it doesn't necessarily change our treatment strategies because we're working on the strengths, we're working on the weaknesses, but in terms of getting the supports in place, that can really make all the difference. And in terms of being able to tell the families like, oh, this is really common, being able to have that open conversation. This is pretty common in kids we see that do have autism,
Yeah.
they develop speech a little differently. And, just being able to be open about that and not have to kind of tiptoe around the subject.
Okay.
Yeah. And then, of course, when they get into schools, if there is an autism diagnosis in place, lots of times they're automatically qualifying for services. We don't have to, wait as long to get some of those services in place than if we're just discovering it, as they enter school.
Yeah. Anything else you would add to that, Laura?
Nope, I think she covered it all.
Okay. All right. What's the like the youngest ages you'll start working with children where there's any concern along this autism line?
I would say, we can start seeing them at that 18-month of age, 24-month of age. And maybe parents are reporting concerns. So then that kind of, we always have those therapy eyes on. So we're always searching for different signs if it is in question. But we can see them at that early age, or maybe even, when they're 5 years old, they're presenting with different characteristics that the parents or the pediatrician may have concerns about. So there's not really one specific age that we start seeing them. It's kind of just dependent on how they're presenting and what their strengths and weaknesses are at the time.
Good. So I'm going to ask both of you kind of specific to your areas of specialty, a question about, so like, let me start with you, Laura. So for an occupational therapist, what are the areas you focus on when you're working with a kid who has or may have autism, and what therapies would you do?
Yep. So a lot of it, the main occupation of a child is play. So we do a big play aspect. A lot of them sometimes present with delayed play skills, or they're just cognitively not at that chronicle age. So we do a lot of modeling of play, showing them appropriate play things, whether it's building with Play-Doh, creating different activities with Play-Doh, or playing with car ramps, or learning our shapes and doing things, but in a play-based manner, just so that they're still having fun and learning as they go. And then a lot of what occupational therapy focuses on is that emotional regulation and development. So sometimes they have a hard time communicating. Maybe communication is an aspect. And so their way, they become frustrated when they can't get across what they want to say. So then we see behaviors or just that emotional dysregulation. So we give a lot of strategies and self-regulations for the parents to implement, but then also as they continue to get older, so then they can do self-regulation. A lot of it is that social participation and just those play activities, as well as the self-care routine. So all of your activities of daily living, whether it's bathing, grooming, dressing, feeding themselves. And then, of course, we can go into that fine motor and visual motor development. It's each treatment is specific to each kiddo. So we do a whole lot of variety of things, but we don't focus on every single aspect of that for every kid, just dependent on them.
Yeah. Great. And I do know we've had a Facebook Live at the Pediatric Rehab Department. But for those people who didn't perhaps see all 103 episodes and can't remember when we did that field trip, Laura, what kind of fun things do we have there at Peds Rehab that is pretty cool?
Yep. So we do have individual treatment rooms, but we also have a big gym area. So it has a swing, we have monkey bars, a rock wall, and a lot of that is good for just overall sensory regulation. So putting their body in that just right arousal level, kind of making them feel at ease, like they belong in their body at that time. And we also have a sensory room, so that's really fun. We have a big sensory wall that has different tactile input, a bubble machine for that soothing and that visual, even the auditory of the bubbles. So we have a lot of fun things here.
Yeah, right. I just want people to get a sense that there's definitely, it's when you say play, we actually have things that kids can play with.
Yep, we're not just sitting in a room the entire time.
Right. And speaking of, just because the foundation is the one that's doing this Growing Healthy series, we want to thank the foundation because the foundation contributed a lot of the money to a lot of these things that the kids have that they can play with. So wanted to give a shout out to our foundation. And when you support the foundation, the work that Laura and Erika do, you're helping with that. So I just wanted to get that out there while we're talking. So Erika, I'm going to ask you the same question I asked Laura, but obviously because you're a speech therapist, it's going to be a little different in terms of the answer. What are your areas of focus and what therapies do you do to help when you're working with autistic children?
Yeah. So first and foremost, we need to find a communication method that the child can implement immediately while we're waiting for verbal language to come in. So in the little ones, that's going to look like sign language or like a picture exchange communication system. As they grow older, if we're still lacking some expressive speech, we might introduce a speech device. So that's like a tablet. And they have basically any word you could possibly think of. You hit a button and it talks for you. Okay. So that's a great option for, we can start that as early as 3. I even have some 2-year-olds that I've been able to introduce that successfully with. And luckily research has really supported the use of, picture exchange, sign language, even high-tech communication devices that, it doesn't actually hinder verbal speech. It actually helps support it because they're getting that constant modeling in. So that's something that we like to establish first and foremost.
All right.
And then of course we want to work on communication and functional activities. So that might be requesting. We want kids to be able to ask for things that they need to. Maybe it's identifying or labeling body parts because we want kids to be able to let us know when they're sick or they're hurt. With older kids, we might be working on more social skills or perspective taking. That can be hard for the kids we see on the spectrum. And I would say this population is an area where OT and speech do have some crossover, especially with, thinking about emotions, thinking about perspectives, working on those social skills. And we do a lot of co-treats with OT and speech with this population, because when the kids are in a good place, sensory speaking, lots of times it's a lot easier to tap into that language. And we see a lot of success when we're able to co-treat. Another thing that I should mention is Laura and I are both trained in feeding therapy as well. So lots of times we do see very selective eaters with this population. So that's something that we work on a lot too, is working on expanding the types and number of foods that these kids will eat too. So, and that's a great opportunity for co-treating as well.
Yeah, very good. Thank you for that answer. By the way, thank you, Sarah, for your comment. Appreciate that. I wanted to, just curious, you start as young as 18 months. How far up age-wise do you go, Laura and Erika, in terms of working with kids?
I think that answer is, again, dependent, depending on, again, that spectrum, going back to the spectrum, we have a wide variety of those different characteristics that we see. So some it may be a few years, we may get into the teen years where then for OT, we can help with the transitioning to getting a job or, more of those self-care activities that they have to do on a daily basis. And so it kind of is just dependent on each kiddo, and again, using our therapeutic minds and really just seeing how they're meeting goals, where they're making progress, where maybe they still have some deficits that we could work on, and just going from there and determining how long the plan of care should be that way.
And it doesn't have to be consecutive either. Sometimes we
Okay.
see kids for, during the summer when they're out of school.
Uh-huh.
Sometimes we're like, you know what, you've been in therapy for several years. We're kind of at a plateau now. But then maybe 2 years later, they're back on our caseload because, they're ready for more therapy. They're older, they can handle it a little better. So,
Okay.
it's not uncommon for
Yeah.
us to kind of bounce in and out of therapy too. And what we always say, whatever works best for the families, whatever is working best for the patients, that's what we're here to support.
Yeah, great. Okay, well, Erika and Laura, thank you so much for taking the time to talk this all through, and appreciate the work that you do there at our pediatric rehab facility, which, by the way, if you know where the hospital is at, you just keep going north and you're going to there's like a four-way, you just go north, and it's before you get out of town on the right is where you're located and everything. But yeah, thank you for all the work that you do helping out with these kids, and for families who have children there. I know that they're very thankful to have you there and the work that you're doing. And for those of you who may be interested in that, I know that if you wanted to reach out to that center, you can, or your primary care doc. Now you know the faces and then the names that you'll see listed as people that help out with kids who have autism. So Laura and Erika, thank you so much. And, we seem to have the Peds Rehab Center on every year or so. So be ready. Thank you.
Thank you.
All right. Okay, very good. So thank you to Laura and Erika. I want to be pretty brief about COVID right now. I just wanted to highlight just on the vaccine side of things. I was just reading this week that of the people that are eligible for a booster, and I'm not talking about the second booster, but I'm just saying that first booster, it sounds like about only 50% of people have gotten that. And particularly if you're someone who is over the age of 65 or you're over the age of 50 and you have some type of risk factor, gosh, I'd at least get the third shot or that first booster. I think that would serve you well. What we know is it doesn't necessarily help you to keep from getting sick, but it does a pretty doggone good job at keeping you out of the hospital or worse. So I want to throw that out there. And the second thing I want to throw out there, I just saw a thing from the CDC today that said basically, if you're under the age of 50 and you're pretty healthy otherwise, they're actually saying to wait about getting another booster. So like that second booster opportunity, if you're under the age of 50 and fairly healthy, wait, because I think the thinking is that at some point in time here, I'm guessing more like the fall or so, a booster that is targeted as best it can be targeted towards the latest mutations will be available. Obviously, it's a bit of a moving target, but right now the vaccine and the boosters are targeted towards those initial COVIDs that came out. So this is kind of the next progression. So if you're under the age of 50, fairly healthy, you want a booster, sounds like your best bet is actually to wait for a little bit. Other than that, I did want to, that's my COVID stuff, unless people have questions for me. I did want to give a shout out today. Every once in a while, we highlight our Sunshine Award winners, and our Sunshine Award winner is Nicole Pitts, who is the HUC CNA on our surgical unit. So I see Nicole quite a bit when I'm walking around. She does a great job, and yeah, she's a very pleasant woman and does a good job here at CGH. And we thank her for her service and want to congratulate her for receiving the Sunshine Award. So I wanted to do that shout out. What we're going to do, because at least right now, thankfully, whatever I'm knocking on, probably wood, the pandemic stuff is not as bad as it has been, that's for sure. So I think what we're going to try to do here for a little bit is we're going to do a couple times a month. And so our next Facebook Live, rather than being next week, is going to be May 5th, which would be the first Thursday in June. And then we have a Growing Healthy series on, I believe, May 12th, which will be about stroke and stroke symptoms. So just wanted you to be aware that we're going to skip next week, and then we'll be back on the following week. As always, I want to thank those of you who took the time to listen in and to be part of this interview process and hear about autism. I encourage you, if you found it helpful, to share it with others who have family or friends who are working through autism or concerned about autism. And I just hope that all of you have, thank you for taking the time to listen. And I hope all of you have a really great week. And we'll see you back on, I got to look down at my notes, on May 5th. Until then, take care.